At Rome's famous Trevi fountain, tourists are taking no chances.
Many people virus, so I scared this mask.
Further north, in the regions of Lombardy and Veneto, the epicenter of the Italian outbreak, several small towns have been put on lockdown.
This discomfort and sacrifice, which for now is intended for 14 days, I hope will prove to be effective to contain the spread of the virus.
But with new cases reported in other Italian regions and in Spain and Switzerland, health authorities are struggling to contain the virus. Scientists say it's vital people do all they can to stop its spread.
The containment procedure is there to effectively dampen down the intensity of transmission and stretch it out, so to prevent an overload in healthcare settings.
Iran is one of the worst affected nations outside China, with hundreds of infections and more than a dozen confirmed deaths. These videos, posted on Iranian social media, appear to show long lines for face masks. South Korea is also badly hit, and the US government has advised against all non-essential travel there. In China, where the virus first appeared in late December, infections have topped 77,000, with more than 2,500 deaths.
The window of opportunity for stopping this disease from becoming a pandemic is narrowing very fast. The entire community at the moment is anticipating this will eventually develop into a pandemic. However, I have to point out that in the past we've had similar fears, and what has happened is that viruses just die away.
The global economic cost could hit $360 billion, according to a report from the Overseas Development Institute, or ODI, which warns sub-Saharan Africa stands to lose $4 billion in export revenue. South Africa's lobster industry is in turmoil after China halted imports of seafood.
The factory don't want to take our fish. There's no market for our fish.
Oil and copper prices are sharply down, and big exporters to China, such as Angola, are suffering. The ODI says Sri Lanka, Vietnam and the Philippines will be worst hit.
Everybody's looking back at the SARS impact in 2003. But of course, if we look back, China is now 4 times bigger than during the time of the SARS outbreak. And it's more connected to the world now through global value chains and manufacturing sector.
Scientists are racing to produce a vaccine for the virus, with the first human trial scheduled for April. By then, the COVID-19 outbreak could be a full pandemic, with serious consequences for national health systems and the global economy. Henry Ridgwell for VOA News, London.